What do you do when you have a physical therapy patient who's on an existing plan of care, gets hospitalized, then discharged, and wants to resume that plan of care? Hey guys, if you don't know me, my name is Tony Maritato, and this is the Medicare Minute. So there's two scenarios here that you could be faced with. Let's say that you have a new patient referral, you do an evaluation, you establish a plan of care, and you initiate treatment. Then that patient gets hospitalized for a condition that is not related to the condition you're treating. For example, it's not uncommon that if a therapist is doing mobile outpatient therapy in the home, possibly for a post-surgical total knee replacement, and then that patient develops a urinary tract infection, they might get hospitalized, go on antibiotics, maybe they're admitted for a couple days, and then discharged. Now, because that UTI was not directly related to the total knee replacement rehabilitation program, there is no need for you to do a reevaluation or even a new evaluation. You would simply document in the medical record that the patient had this complication, they were hospitalized, this was the intervention that they received, and now 3 days later, a week later, you're resuming the existing physical therapy plan of care. But on the other hand, if the condition that caused the hospitalization was impactful to the existing plan of care, then you would either do a reevaluation, or you may actually have to discharge the previous episode of care, initiate a new evaluation for a new condition, and then start a new plan of care. And one of the examples I usually give is, let's say I'm treating a patient for hip pain. I complete my evaluation, and maybe there's a little bit of an indication that there might be something more going on than simple osteoarthritis. Turns out the patient gets hospitalized because they fell at home, they fractured a hip. Maybe there was a pre-existing hip fracture that you were suspicious of, but it was never confirmed. Now they've had hip surgery and ORIF. They're being discharged from the hospital and they want to resume therapy with you. That would be a situation where, based on your determination as the therapist, you would either do a reevaluation or you would discharge the previous case, start a new case, a new plan of care with a new evaluation. Any of these are reasonable solutions to the situation, but once again, if it's a condition that caused the hospitalization that is unrelated to the existing plan of care and is not impacting the existing plan of care, you would simply resume therapy, making the clinical documentation reflect why the patient was hospitalized.